everybody's going to have the opportunity. We're meeting with our clients right now, and it's scary to everybody because we're still not sure, A, how many of our people who are not taking our insurance are now going to be on our insurance to jack up our costs. Restaurants in particular are, starting to semi-panic about it. I was talking to the guy in charge of it. I won't say the name of the company, I guess, but one of the most well-known restaurant organizations in the nation. The head of the PPACA legislation within the organization, and then the government relations guy is a good friend of mine, and he told me that of about 8,000 of their hourlies, he thinks about 1,200 of them will get on their plan. So that's a big move for them, but there's still going to be 8,000 or 6,000 or 5,800 that are not on taking insurance and they're only going to try to charge them about $95. But they know, and I know too, the waiters and waitresses are not going to pay it. And they'll go to the exchange. Well, the exchange is going to be more than $95, I can tell you that. So they're going to say no, they're going to say no, and then they're just going to have to pay the penalty, the $95 for year one. But they think they have about 2 years of that. And then beyond that, they don't know really what's going to happen. And I guess really we don't either. One thing to know is this is still a moving target. And then if it gets really bad for the Democrats, according to my buddy over there, he's saying that behind the scenes, all the Democrats are afraid of elections for 2014. So they're starting to go to the Republicans to say, let's work something out. And one of the things was he was the one that told me that it's possible that it'll be enacted. It'll be there 2014, but the government's going to say we're not going to, enact any of these excise things and these other fees that are involved.
If there's going to be a mandate, will the premiums also be controlled?
No.
So that the insurance companies can charge anything they want?
Yeah. Supposedly there's competition though.
Among the four.
Yeah.
Which of these? What are the names?
Aetna United, Blue Cross and Blue Shield, and Aetna United and Cigna.
Is there going to be across the state selling?
Yeah. There'll be competition in there, but it's just going to be hard. It's just going to be hard. I think that's going to be the cheapest right out of the gate. Because they're going to be fighting for share. So we'll see. We'd have no pricing currently. So it's going to be fun.
What about the exchanges? How will be pricing the exchanges?
We're still waiting to see. Still waiting to see. So there's a thing called minimum essential coverage. The IRS, the government is telling your company, if you own a company, if you have over 50 employees, by the way, 50 full-time employees, and there's some math that you can do, very simple actually. It's the number of hours worked per month for your part-time population divided by, I believe it's 120 on a monthly basis will give you full-time equivalents. So if I've got a guy that's got 4 salaried, and he's got 100 hourly. And he thinks what he's going to do is get those hourly guys down below 30 hours a week, because you have to be, if you make 30 hours a week, you've got to provide them health insurance. They're considering, if you have 50 of those people, full-time employees, then you've got to obey all of this. If you have less than 50, you don't currently. Okay, so I don't know if this is too much detail, but if I've got 100 employees and I've got 4 salaried right now, he's only covering 4, and the rest of he makes pallets. So wooden pallets, and one of the largest, and he's right down near downtown. Doesn't provide health insurance, so, all Mexican population, and and I told him not to do that because I think that's just a temporary fix. Even though I brought the paper here, and somebody else is going to do that also, but I told him just not to offer health insurance and let everybody go off to the exchanges if he wants. So we're still analyzing that, but So minimum essential coverage that you have to offer your employees. It's a value of 60%, and it's not just that's a formula for your premium that you're charging plus the plan that is being offered. So 60% is the number. They call it the bronze plan, and that's the low cost plan that must be available to all employees, and you as the employer are not allowed or shouldn't charge or can't charge more than 9.5% of their income. Now, it's written as their household income. Of course, you don't know what that is, so we're telling our guys to just don't stay below 9.5% of that individual employee's income. But the way we think about it is, if a guy's making $20,000, that's $2,000 for the year. So that's about $180 a month, isn't it?
Mhm.
So $180 a month, and I know by experience they're not going to take it. If you say, here, I'm offering you this, I'm going to charge you $180, they're not going to take it. This is why, and then they'll go off to the exchange, say no to the exchange, and then they'll pay the $95 is the way it currently looks like it's going to happen.
That's $95
Premium
a year.
assistance, by the way, is available. It's there's going to be some, if you make 400% below the poverty level, I think I read recently that even like $80,000 a year for a family of 4 is below the poverty level of 400%. So it's kind of interesting. The math on that is really kind of interesting. So, but if you make 400% less, then you're eligible in January for premium assistance
That's 400% less.
than the poverty level. And that's
How does that work, 400%?
well, you just multiply whatever that poverty level is for your zip code, for your income, and then if you
Okay.
stay below 400% of that. But the important thing to know about that, the government will give you some premium assistance. We don't know what that is yet, so we don't know what the net is going to be. But what's interesting is you're not eligible for that if you have an employer who has offered you this and wants to charge you $180 a month, and you say, no, I can't afford it, and you say no to that, and you go down in here to the exchange, you're not eligible to get government assistance. You become ineligible because you've been offered it here, even though you can't afford it, and you could afford it here. We still don't know what the premium assistance is going to be, but you're not eligible because you said no here. So that's
Which premium
kind of a
assistance?
gotcha there, that you're not eligible for government assistance if you work for an employer that is offering you the insurance. Okay.
So what responsibilities does an employer have to track that cycle of somebody turning down insurance coverage that's offered?
What I understand right now, all I have to do as the employer is this.
So we don't care at that point
Right.
if they, okay.
Right. You've done your job, so to speak. But this is going to be available for those who don't have this. Yeah.
What's the minimum essential coverage cover, and what's the?
I think that's a little too deep. It's going to be very basic insurance. It's going to cover 60% of your expenses.
So back on that penalty.
Yeah.
You said $95.
Yeah.
That's the first year,
First
correct?
year.
But don't those penalties go up?
Yeah.
Pretty
I
quickly.
think I saw 2016, which is just 2 years ago, is $700.
Yeah.
Yeah.
I thought I
Probably
saw
up
that
to
as
there.
well.
Well, here,
So-
maybe it is right here. Year 1, year 2, year 3.
Okay.
Okay, percent income goes to 2.5% of your household income. But again, that's not your problem either, as an employer.
So Mark, I have a question.
Yes.
Is it possible that sometime down the road, employers will stop offering insurance and like a cafeteria
Yeah.
plan, give you some dollar
Yes.
amount and say, go figure it out yourself?
Yeah. There are smart people that believe that this is just the beginning of maybe 5, 6, 7 years where we'll just have a big old single payer like, essentially every other modern country in the world. So this is just the beginning towards that. and I was reading an article this morning, as a matter of fact, or what was this, about what a doctor's life is going to be like 5 years from now, and they were, there's 35,000 doctors, 30,000 doctors leaving the medical profession a year, and there's 20,000 going in. I think it was 35 and 25. So we're having a net loss right now of doctors. Some other features about that I think we're each, but they're going to be employed, basically. They're going to be employed of an institution rather than having their own
They're
practices.
expecting over 100,000 shortage now. As of today, they need like 50,000 doctors, right now. American doctors.
So Mark, we have a guest here from Blue Cross and Blue Shield.
Oh,
So-
I noticed him. Hi, Ron.
Morning, Mark. How are you?
Good. By the way, I've recorded this for your benefit, so you can bring it to Blue Cross and use it as a training program for your.
Perfect. I like it.
Do you want
As
to
you know,
correct
we work with
anything?
you.
Do you want to correct or add to anything that I've been saying?
Other than the fact that I don't think I'll correct anything. Adding, I mean, it's obvious that the complexities of the law going forward are almost overwhelming. And it's, the gentleman here, I think, is very astute when he asked the question
Yeah.
about the move to defined contribution.
Yeah.
I have long held the belief that the move to defined contribution is the ultimate end game for the employer.
Yeah.
That clearly came to me in reading a Fortune interview with Randall Stevenson, AT&T CEO, where shortly after the ACA was passed, they were focusing on the $2,000 per employee per year penalty should an employer with more than 50 refuse to or decline to offer insurance. And he said, well, I've got 300,000 employees, that would be $600 million a year. So your first thought as you read that is, well, they're going to offer insurance. Then he went on to say, but my insurance coverage cost me $4.7 billion a year. Do the math.
Yeah. Well, that's right. 'Cause what you're saying is that is, and we're a unique country where your employer is tied to your health care. I mean, our employer is not tied to our insurance of our home and our car, but that's old news. So I think we are moving in the direction where we're not going to have, and I wouldn't mind that as an employee, and I think might be healthy for America if we ever get to that point. But the exchanges, now let me ask you this, I was talking about the exchanges kind of generally. Is Blue Cross is going to be ready for an exchange? And in fact, all the carriers are going to be ready
Right.
to have an exchange January 1st.
Right.
Now, the ones that are right now that everybody's saying that we're worried about being ready, those are the individualized per state, like Texas, for example. Can you talk a little bit about that? About like what's in theory in danger of not being ready?
Well, I don't know if I can get down to that granular detail. We do know that the current administration in Texas has never looked fondly on exchanges. In fact, we couldn't. It was recommended that you don't even utter the word exchange, if you will. But obviously now the feds are scheduled to come in and to run the exchanges. I think one of the big concerns that insurance.
Federal exchanges are the ones that are going to be we're
And
all
are they
going to be
gonna be
shocked if they're going to be ready.
Exactly. So that puts us all in a quandary. What happens when registration starts in 2014, in October of this fall for the
But
2014?
Blues, Aetna, United, in theory,
Right.
are going to have an exchange ready and up and running that we can direct employers to go to. And then each individual employee within that employer group can go and pick whatever plan is on that exchange, and the employer can just say, hey, I'm paying $300 a month to you, and you can use it for whatever you want on the exchange. So that should be ready by 1/1. And there's such things as private exchanges, stuff like that.